Hello, everyone, and welcome. It is 11:30, and we will get started with the Culture of Data Conference. Lindsay, I'd like to take down that screen just so we can have a larger view of the videos. Thank you. My name is Allison Rosenthal, and I am the director of the Culture of Data Conference for the Colorado Public Health Association, or CPHA. On behalf of CPHA, I would like to wish you a happy National Public Health Week and welcome you to the Culture of Data 2023 conference and keynote session. We also have Lindsay Wyatt here. Her pronouns are she, her, and she's the associate director of our conference. Lindsay was appointed to this role in February and has done an incredible job of stepping in during the height of our planning session, and I am just very grateful to her. Lindsay, if you'd like to introduce yourself to our audience.
Yes, good morning. My name is Lindsay Wyatt. I am the Associate Director of the Culture of Data Conference. I'm super excited to be here today. My background is in mental health policy, and so I'm really passionate about bridging the gap between lived experience and stories and our data. And so I'm really excited to be here with y'all today and tomorrow.
Thanks so much, Lindsay. And as you can see, this conference is a collaborative effort, and we would not be here today without the assistance of our Culture of Data Planning Committee and the CPHA board. I also wanted to personally thank CPHA's Executive Director, Rachel Massman, for all of her support of this conference and CPHA. Just a few housekeeping notes. Throughout the session, if you have any comments or need assistance, please feel free to use the chat. Lindsay Wyatt, who's also here serving as our tech host, will be there to assist. All the conference information, including Zoom links for each session, can be accessed through the SCED website. Slides and handouts for presentation are already on SCED, and the recordings will be posted there this month. There are also 2 walk and learn sessions, which are audio only presentations, kind of like podcasts. And we encourage you to step away from your screen for a walk or another activity while you listen to those. Those are available on demand, so you can listen anytime you choose. If you had a chance to take a look at your schedule this year, I hope that you noticed a few new program offerings. Our committee just hosted a networking reception called Coffee and Connections, and I really enjoyed getting to see those of you who could make it in person, getting to meet you. We also collaborated with the Emerging Leader Committee on an Emerging Leader Showcase this year. Please join us 9 a.m. tomorrow morning to hear from rising stars in the data and evaluation community in Colorado. And these speakers will be discussing their work on youth substance use prevention in Boulder, environmental justice in Commerce City, and the availability of victim services in Colorado. So you won't want to miss our new program offering. This year's conference theme is Breaking Down Silos, Public Health Data and Community Action. And our theme really symbolizes CPHA's commitment to advancing racial equity and how our data systems can facilitate this transformation. We hope that you will feel inspired after hearing from our conference speakers who are showcasing innovative ways to break down siloed organizational structures, as well as public health planning processes. Our speakers are also modeling new ways of community engagement that enhance community buy-in, commitment, and sustainability and equity to the work at hand. Now I'd like to introduce our CPHA board president, Weaveen Gongo, who would like to greet you and reflect on this conference.
Hi, thank you so much, Allison, for the introduction, and to you and Lindsay for putting together such a great conference. I was at the Coffee and Connections this morning, and the community was amazing. It couldn't have gone any better. So thank you all for everything that you do, and the emerging leaders and CPHA as a whole. So yeah, my name is Weaveen Gongo. Just slightly briefly about me, my background's in medical and public health research, health programs management, community engagement, and justice, diversity, equity, and inclusion initiatives. My passions center around addressing racial health disparities for Black and BIPOC communities. That's Black, Indigenous, people of colors. And this, included my time with several CBO efforts, obviously CPHA, the Denver Justice Project, other community empowered groups in the Denver area, as well as in Chicago area where I am from. And so I'm excited. I love that during the pandemic, CPHA has officially committed itself to operating as and being and embodying anti-racism and being an anti-racist organization. And for equity and justice to, in the words of Jason Vitello, my predecessor, for equity and justice to finally prevail, public health must not remain colorblind and passive or neutral in this struggle, but must be proactively race conscious and anti-racist, right? And that is just more than writing something on a document saying, hey, we're anti-racist and we're doing the work. We have to do the work, which is why I'm really excited about that central piece in this conference. Again, it's just such a great theme, and I'm excited for all the talks that are ahead. Such commitment that we have taken in CPHA is not just about being woke or saying the right words, but it is doing the work. It's walking the walk. The dismantling of systemic racism will require sustained efforts, such as cross-sector coordination and collaboration, professional public education campaigns, community engagement and co-creation, and policy reform. So we at CPHA, while we are committing ourselves to building an anti-racist public health movement, we are also wanting to take strategic initial steps in that process to really walk that walk. And so we hope that in the future, later this year, in our Public Health in Iraqis conference in September, that you will join us again to hear some of how we've done that in the upcoming months. And so with that, I will pass it back and actually pass it on either back to Allison or Amy Hawn Nelson. I'm so excited that Amy's here, and so I'll just stop there and enjoy the rest of the conference.
Thanks, yes. Thanks, Weaveen, for that introduction and for your continued support of this conference. Another supporter of this conference is the Colorado Equity Compass, and we thank the sponsor for their contributions to this conference. Rochelle Espiritu, who is our representative, could not be here, but would like to share a message with us, and we will play that video now.
I am going to share my screen.
Thanks, Lindsay.
Good morning. Welcome, colleagues and fellow Coloradans, to the Culture of Data Conference. We're pleased to be a sponsor for this conference, thanks to funding from the Colorado Trust. My name is Rochelle Espiritu, and I'm a managing partner at Change Matrix.
And my name is Jeff Bontrager, and I'm Director of Research and Evaluation at the Colorado Health Institute. And we're both partners in the Colorado Equity Compass Collaborative, which includes Change Matrix, the Colorado Health Institute, Consume and Create, and the Colorado Trust. We wanted to welcome you to the 2023 Culture of Data Conference. The Culture of Data Conference is designed to strengthen the use of data to achieve health equity and create the healthiest Colorado for everyone. It fills us with a lot of joy to see such interest in gathering to discuss how we can break down silos to move public health data to community action. We're excited to learn alongside you as we discuss how to ensure our data works in the service of equity. One of the objectives of the conference is to highlight data sources and methodologies to identify and measure community assets and health equity. In other words, how can we build a culture around data that lends itself to be used by communities and excite collective action to achieve those improvements? Well, we are honored to offer the Colorado Equity Compass as one of the tools that will be highlighted at this conference.
So the Colorado Equity Compass was created because we heard from many communities that there was a need for local level data and a platform to tell their stories. So the CEC is a local, multifaceted platform that provides a wealth of information on what equity looks like in Colorado. We seek to equip change makers and decision makers with the necessary data and stories to understand the specific barriers facing community members and to discover solutions that work for Colorado. With the Colorado Equity Compass, we strive to illuminate the disparities that are present in our communities through data storytelling. By acknowledging these divides, we can make better community-informed decisions that ensure that everyone can access resources and opportunities that they need to thrive. We are incredibly excited to share this powerful and beautiful tool with Coloradans across the state. We continually work to improve the platform so that it works to support community-driven, social determinants of health-focused work in all of our communities.
So one component of the Colorado Equity Compass is the Equity Data Navigator. And the Equity Data Navigator shows both social factors and health outcomes, allowing users to compare and understand these factors. It also allows visitors to compare neighborhoods or counties to one another. A unique aspect of the Colorado Equity Compass is the focus we have on bringing together data and stories. On the Colorado Equity Compass site, you can learn more about individuals and families that make up the diverse communities throughout our state and their lived experiences.
We encourage all of you to think about how you might utilize the Colorado Equity Compass platform as we continue these discussions throughout the conference. We're excited to see and hear from all of you how this platform can support your work as we move through this conference and beyond. If you would like to learn more about the CEC, please join our session on Friday at 10 a.m. We want to thank you once again for being here and sharing in this exciting, meaningful event. We hope you're as energized and excited as we are to get to work and put new ideas into practice. We look forward to the insights and ideas from all of you throughout the next couple of days. And as we move forward, we encourage you to tell us how you've used data alongside community members to advance health equity. We know every story counts, and when they're shared, communities thrive. Thank you.
Thank you for that message, Rochelle. And thank you, Lindsay, for operating the tech for us. With that, it is my great pleasure to introduce you to our keynote speaker, Dr. Amy Hawn Nelson. She is a research faculty and the Director of Training and Technical Assistance for Actionable Intelligence for Social Policy, or AISP, initiative of the University of Pennsylvania that helps state and local governments collaborate and responsibly use data to improve lives. She has provided in-depth technical assistance in support of cross-sector data integration in 30-plus sites across the U.S., including the development of 100-plus data sharing agreements and serving as an investigator on 25-plus studies using integrated data to evaluate program and policy outcomes. Prior to joining AISP in 2017, Dr. Hawn Nelson was the Director of Social Research for the University of North Carolina, Charlotte Urban Institute and Director of Integrated Data Systems in the Charlotte region. She was a lead author on Finding a Way Forward, How to Create a Strong Legal Framework for Data Integration, a toolkit and a toolkit for centering racial equity throughout data integration, as well as AISP's Introduction to Data Sharing and Integration. She is a community engaged researcher and has presented and written extensively on data integration and intersectional topics related to educational equity. Dr. Hawn Nelson will be talking today about centering racial equity in data integration, which is a fitting start to our 2023 Culture of Data Conference on breaking down data silos. So thank you so much, and take it away, Dr. Hawn Nelson.
Thanks very much. So if I can just take a moment to figure out a technical piece. If I put something in the chat, okay. All right, there's gonna be a little lag because I use the chat quite a bit and I didn't realize the functionality was different, but we're gonna start out with what just got dropped in the chat. Thank you very much. If we could just introduce ourselves. So tell us where you're from without telling us where you're from. So I'm from the Queen City in the land of the pine, 2 hours from the Great Smokies and 3 hours from the Outer Banks. Spoiler alert, I do not live in Philly, if that helps.
Chat is disabled right now. We have our Q&A.
Okay. Can we enable it?
Give me 1 second. I'm trying to figure that out.
Sorry,
Would we like to use the Q&A feature while we figure out the chat?
Yeah, that works. All right, and I'll go ahead and start sharing some slides. So here we are. We're going to do a little introduction. In fact, I think the chat works. The Q&A works. City that never sleeps. I think I know that one. Yeah, this works great. All right, so tell us where you're from without telling us where you're from. All right. These are great. The land of corn. I think I know that one too. Okay, I got lots of Denverites, which makes total sense. All right, in the Q&A, are we able to see everyone's responses? Folks in the saying they can't see others. Sorry, y'all, there must be some kind of Zoom setting that we're I was not anticipating because I rely on chat a lot for the presentation. So
My apologies. I will look to see how I can enable the chat. We have a lot of people that are saying they're from the Mile High City.
Yep, they're great, and we'll figure these out. So
Okay.
All right, let's roll for now. Thank you. This has given me a great insight into who's on the call. So I am from North Carolina. I live in Charlotte, and you will see that through my slides because I give lots of North Carolina specific examples a little further on. All right, so let's keep on rolling. First, I want to just introduce the idea of AISP. AISP is like the bio said, a small initiative out of UPenn, and where we began was this research around homelessness. If anyone's ever heard of this, it was a very well circulated, well-known article back in 2006 around a resident of Reno. They referred to as $1 Million Murray, not his real name, of course, who, because he was not housed, he cost government essentially $1 million. And so this research is kind of describes the value of AISP and kind of what we do, right? So our idea is that we can take, disparate data, put it all together to help us understand very intractable social problems in ways that we didn't understand them earlier. And the way this all came about was because of the research of Dennis Culhane, who is the founder of AISP. So this is the best way to explain kind of who we are and what we do. We are focused on social policy and the data that helps us better understand social policy, the impact and programs. So what this research showed was what we now know to be commonplace, but back 15 years ago, this was not the case, right? We didn't realize that it was better for everyone, especially those who are experiencing homelessness, to provide housing first. So this led to the housing first movement, which we now see as just good practice. But this was a very new idea 15 years ago before we were able to put the data around it to show that not only is it better for people, but there's also return on investment. So it's better fiscally as well. So just to make sure, because I want to make sure we're good with the audience, I talk in my work, we are focused on ethical use of data. So we talk about data sharing and data integration. We see these concepts as different, but very related. So here's just a very simple example of the difference between data sharing and data integration. Data integration inherently involves identifiers because you are linking across a life course. So it's really important to think about data integration as a privacy and security risky endeavor. Like by definition, what we are talking about is, there is risk inherent in the work. So just want to be clear that that is what I say when I'm talking about data integration. Our work is around bringing data together across silos. So we are, do a lot in the housing homelessness space. But we work across all systems. The majority of our work is looking at health and human services and education, but we support integrated data efforts across all social realms. This is the core of our work. We run a peer network of sites. You'll see that Colorado is a network site. There's some very advanced data integration work that happens in Colorado that we have supported since that began. And have learned a lot from based on their efforts. So our work is really around building a peer network for folks who are doing this data integration work and allowing people to learn alongside each other. There we go. Okay. And our work, a lot of people, they read a little bit about us, like the elevator speech, and they're like, oh, so you're all like data people, you're technologists, you must all be like quantitative methodologists. And we're not. In fact, most of my work is mixed methods, but the core of my work is actually qualitative. And we focus a lot on the integration of people to create governance and channels of communication to use data better and more ethically. So we talk a lot about data sharing being incredibly relational, much more than it is technical. And we have to think about integrating people and staffing as much as we have to talk about integrating the actual data. Another way to think about what we do and where my vantage point is in talking to you. I know there are a lot of EPIs on this call and a lot of folks who do the analysis of data. While that's a core part of our work, we really focus on this idea of, there's a lot of work that goes into the analysis, kind of upstream of that. So we like to think that we focus on the CALE part of the work. So we're looking at governance, we're looking at legal, data cleaning, linking, standardizing, harmonizing, all of those things. And then the goal is to create usable data with insights that can drive change. Not just like the fun stuff that we refer to as the banana. And the CALE often takes a lot longer too. It's very difficult to fund, which makes it hard to focus on, but that is our focus. So the main thing to remember from our work, and you'll hear this throughout any comment I make today, is that we are singularly focused on ethical use of public sector data. And in the United States, in our highly racialized context, this means that we center racial equity in all that we do. So you're going to hear some more about that as I talk through today. But we see this all connected. So when I'm talking about data governance, or I'm talking about legal frameworks, or I'm talking about equity principles and data use, to us, this all falls under the same bucket, which is ethical use of data. All right, here's our test to see if the chat is enabled. Dun, dun, dun.
I am still working on that.
Still working on that. Okay.
Yes. I see Q&As. I'm wondering if it would be beneficial that individuals place their comments in the Q&A and I can do a summary in the chat to everyone.
Okay, you can try that.
So
right.
If y'all want to use the Q&A section and answer racial equity is in 5 words or less, I can definitely compile our responses and place it for everyone to see.
Sure, and we can also just roll. Okay, so let's just roll. Let's, so if everyone, for this, I'm gonna ask you to do some reflection. There's actually gonna even be like a reflection break in the middle of the discussion. So if you just have a piece of paper nearby, or maybe you prefer typing. So if you would just jot down, like in your mind, what do you see as racial equity? And then I'll provide a definition that we like a lot. So I'll give you a couple seconds. Also, feel free to drop it in the Q&A. I can see all the Q&A, I think, as a panelist, whatever's easier. But just think to yourself, what in the chat, or I mean, to yourself, or drop in the Q&A, racial equity is. All right. Quality health for all, healthcare for all. Inclusive. Providing appropriate tools to each racial group according to their specific needs so they can thrive equally. Freedom from oppression and fairness. Access, empathy, honesty, inclusivity. Fair for all. Great. When race can no longer be used to predict life outcomes. Excellent. Okay, opportunity for access of services. Being seen and heard. Excellent. All right, so we all have slightly different definitions. Of course, these are all, similar ideas to what we're experiencing here. So this is the definition that we tend to use right now. We've actually shifted our definition here multiple times, as we learn more, know more, do better, right? We like to think of racial equity as both a process and an outcome. And so you have to be focused on both. And this particular definition is from Race Forward. If you're not familiar with their work, I'd encourage you to check out their website. They have some really great resources and have thought carefully about all these issues for many, many years. So the work I am talking with you mostly from today is a center in racial equity throughout data integration. This is a toolkit that we published back in 2020, but it still remains very relevant today. Let's see if I can drop the link. All right, I'm going to try and drop the link that we will try to share with everyone for the toolkit. All right, it is very easily accessible if you Google it as well. So the toolkit is, not a beach read, as its title would suggest, but we like to think that it's fairly readable. It's meant to be very modular, so you can pick it up and read what you need rather than the thing front to back. What we focus on is positive and problematic practices throughout the data lifecycle. We talk about work and action, so all of our work is deeply applied. If we talk about it, then it is something that we have seen work, or actually we've seen in practice through our network. So there are also lots of activities for you to use, and we encourage you to use any activity that I use with you today. These slides will be available. Please use them in your context as helpful. So just a little bit about the process, because the process is a really important part of our work. This work on the toolkit began back in 2017, 2018. This was a participatory project. So we had a large group of folks who contributed to this work. I was the main cat herder and got a lot of stuff written down, but the ideas that you're hearing today are from many. And there's all the lists of the authors and contributors in the document. Now we are working to operationalize these ideas. So we have something we call our equity and practice learning community that I'll also drop in the chat for you. This is our newest round of work where we are trying to take the ideas of the toolkit and support agencies in actually using them to do this work, which is really hard, right? And so that's where we are now. We actually just closed out on last Friday, our RFA for cohort 2 for this work. So more to come. We're still very much in the mucking through the muck stage of this work, and hope to have some clear findings for everyone by 2024 is the goal. So I also just want to mention this. This is an old slide, old concept, nothing new about it, that is focused on this idea that we are many things at once, right? So we are individuals. We have these identity dimensions that are a part of ourselves as individuals, and they affect our work, right? So me being a middle-aged white female who was born and raised in the South and who still lives in the South, my identity dimensions really shape everything that I am and everything that I do. And this is really important, right? Because these identity dimensions give us perspective and position, but they also involve power, right? And we know that power is the central feature to affecting change. So I just always like to ground people before we really kick off this discussion, to think about your own identity dimensions and how these show up in your work and in your thinking. Because we are, at the micro level, these identity dimensions matter, right? And then the meso levels in our institutions, in our organizations, that meso level, and then the macro level, how all these things fit together for systemic outcomes. This is all really important. And we like to just remind folks that the work is at all 3 of these levels, right? So we need to be working both ourselves, working with our micro, we need to be working within our agencies and locus of controls, and we need to be thinking systemically. That's really hard to do. If anyone figures out how to do it well, let us know. But it's something that we just really think is important to keep forefront as we think through these tough concepts. So we're not going to do this in the chat. But again, I want you to think again to yourself, how comfortable are you with use of data, particularly it's administrative data? So that is data collected in the routine process of administering programs from government agencies, right? A lot of you are probably using administrative data in your day-to-day activities. This would include public health surveillance data is a very common example of administrative data. So think about that. So how comfortable are you with concepts related to reusing data collected by government? Probably most of you are pretty comfortable. And then think, how comfortable are you with concepts related to racial equity? This is something that a lot of us may have interest in and dedication to, but probably not formal training around, which, you know, is a challenge, but also an opportunity for us to do better. And then the last one is like, how comfortable are you in being uncomfortable? That's a really important part of this work, is just knowing that this work, if you're not uncomfortable often, you're probably not doing it right, which is hard to hear, but important to remember. All right, I'm going to guess that most of us aren't high on all three of those. There might be a few people that are, but most of us are going to have some variance here, and that's totally fine and acceptable. But again, something that we just think is important to point out. All right, here is the main thesis of the toolkit. If you don't want to read, you know, I think it's like 76 pages, a single space, difficult concepts. This is the main idea, right? We have a place, and we have a point in time right now in 2023 where we can acknowledge that data infrastructure is infrastructure, first of all, and it is enduring, right? So we have a choice right now to be race explicit about this infrastructure that we're building, or we can pretend like data are neutral. Just as, you know, we have examples of this, right? Just as in the 1800s, we had railroads, 1900s, we have the highway systems. We know that both of these infrastructure projects decimated some communities while privileged others, right? We know this from history. And even from looking out, in some places our front doors or back doors. I have a railroad that goes right near me. So thinking, and we decimated multiple neighborhoods, Black neighborhoods in my community right near me through the highway system. So this history is living in our face, right? And we have to acknowledge this and then commit to doing something different. So this is our attempt at committing to doing something different. We like to think about the data lifecycle as 6 stages. So this is, again, like not really surprising. Hopefully this is familiar to everyone, but just to make sure we're on the same page, we think about it as a recurring cycle, but generally it starts with planning and then goes to data collection, data access, use of tools that includes algorithms, analysis, and then reporting and dissemination. And the overall question is like, at what, you know, where should we be centering racial equity in this work? And the answer is kind of everywhere, right? The work has to be centered at the very beginning when we're figuring out how to resource work appropriately and how to staff it. And then we also have to focus on it throughout all parts of data analysis and reporting. What we have observed in this space over the last few years is that there's a lot of attention that is focused on the use of algorithms and the analytics and kind of reporting piece of this. But we see the most opportunity for equity shifts at the beginning stages of the data lifecycle. So you'll hear a lot of my comments focused on that. If you read our work, you'll see that we don't really talk about algorithms very often. It's just not of interest because other people have that covered. So we tend to talk a lot about planning, staffing, resourcing, and then, you know, collaboration, and also just data governance frameworks, which would all be part of like the planning data collection piece.
Oh, and Dr. Hawn Nelson, before we move on to the next concept, Kim Boyd has a question. Is it okay if we unmute her?
Sure. And I can't see anything in the chat. So.
Oh yeah, of course, yeah.
I will unmute Kim and allow her to speak. Hand has been lowered. Kim, if you have a question, feel free to raise your hand again. We do have a question that came through in the chat. At some point, can you give an example of poor racial equity integration and
Yes.
one that is very good?
We will talk through that together. Because the answer to that question is it all depends. Because what may be ideal in one community may be a horrible idea in the other, because all of our communities are different. So we will all have an opportunity to do that ourselves. All right. So let me frame out a few more things, and then we're going to go to like an actual activity where we talk through exactly what Mike just asked about. We're actually going to go through some risk benefit scenarios together. And I'm going to frame that out in just a second. In fact, that's my one other slide. Okay, we're going to talk about data access in a moment. So think about the data access is just like the way in which we make administrative data. This is data about people held by government agencies, the way we make this available. There's a lot of open data in the public health space, right? In fact, some folks think it's a big goal to have most data open. I don't necessarily adhere to that, but I like open data if it's very, very carefully considered. So we'll talk about open data a little bit. Most of the work that I do is in the restricted data realm. So it's data that is usually has some identifiers around it and has protections where you have to have legal agreements around it. So it is permissible to use these data, but you have to, have the right question, have the right user, right purpose in mind. And then there's some data that are just unavailable. We frame this out just because it's important for people to remember, like some data is just not collected. Like a lot of places do not collect immigration status for a very good reason, right? That data is just literally not available. Or another one would be data that exists but can't be shared. So there are extreme protections around domestic violence data is a good example of that one. And then there's sometimes unavailable data for technical reasons, like a server, goes down and the data is not retrievable, or someone mangles a spreadsheet, right? We've all been in that situation. So sometimes the data just doesn't exist anymore for a technical reason. So this is a tool that we use to think about any kind of data use. So we are going to use this tool for the next few minutes, and we're going to walk through examples where we see data use in the green. So we consider green to be high benefit, low risk. And then we're going to talk through what may be examples of data that is high risk, low benefit, and then kind of the middle grounds, right? There's high risk and high benefit, or low risk, low benefit. Hope that makes sense to everyone intuitively. If not, we'll walk through it. So you'll have time with it. Okay, the way in which we're going to approach this is through a tool, and I'm going to drop in another link to the chat. This is another guidance document that we published last year. It is a legal specific report called Finding a Way Forward, and it's how to create a strong legal framework for data integration. So it is geared towards folks who are working on cross-sector integration. And these are the main questions the entire framework is based around. So before any use of data, these are the 4 questions we ask that you ask yourself. So is it legal? I want to point out that is the first question because it is the lowest bar. Is it legal? Doesn't mean it's ethical, doesn't mean it's a good idea. It just means it's permissible. So is it ethical? It's a big question, right? Like I may see data used as ethical that you may not. Ethics are very ambiguous, murky, gray, whatever word you want to use. Ethical use is nebulous. So how do you decide if something's ethical? You talk about it, right? It involves a process of discernment. The next question is just, is it a good idea? Like, would the resources you use to do the analysis be more than just giving housing to someone, for example, right? Like, are the resources you would use to attempt to put analytics around a problem more than just solving the problem? Or could you come up with an analysis that has no action? Like a good one there is a lot of school data. They say, oh, well, we would target students for outreach. And it's like, well, you've just cut school counselors from budgets. So who's going to do that outreach, right? So is it a good idea? It means like, do you have the resources around it? Do you have staffing? Can you even make this actionable? And then the last question, the answer to this is data governance, right? How do you know who decides? There needs to be clear process. There needs to be people making these decisions around it. So this just walks you through it in more detail. Again, these slides are available to you. So please use them. So is it legal? A lot of these are the ways that things are made legal. Most of us have contracts in place. That's data sharing agreements, MOUs, data use agreements, things like that. There's a lot of authorizing legislation. For example, public health authority. I'm certain that most of you are operating under that. So these are just examples of legal authority. Is this ethical? This is just one example of one group's determination of what is ethical use. So this isn't the answer, this is one answer. Is it a good idea? So availability, resources, and action. So this is the way that we frame this out. And then how do you know who decides? The answer to this is always governance. All right. So we are going to take a very short break. We're going to take a 5-minute break because we've been here for a while and you've been listening to me chat. And when we come back, the next half of the presentation is all discussion and thinking through this risk versus benefit piece, right? So I'd encourage you to take a little break, stretch your body, do whatever you need to do. We have 5 minutes. Sound good to everybody?
Great. So we will return at 12:16.
Perfect. All right. See y'all in 5 minutes. All right, y'all, let's dig in. There is a really, really important question in the Q&A that I want to lead off with because it's a great example of this green box right here. So the question from Allie is a question around like terms for categories for race and ethnicity. I think we can all agree that any term that we create for race and ethnicity is necessary and completely insufficient, right? This is one of those hairy problems where there's just no good solution. So instead of a good solution, you're always picking like the least bad approach because we just haven't figured out how to do it well. And there aren't very many, in my opinion, there are not gold standards around this. So my summary thought is that there has to be governance around this to do it well, if there's any opportunity. And I will say that there's an opportunity right now. OMB is redoing the federal classifications for this right this moment. And they have, through the Federal Register, have open responses. So if you have strong thoughts, please weigh in, like Google that. If you just Google like OMB race ethnicity data review or something like that, it should pop up. If not, email me and I'll send you I think it closes next week. So we should have some federal guidance soon. In the meantime, I will say that what we recommend is kind of two approaches. So there needs to be race and ethnicity data collection in my mind, it's for two ways that you need to do it, right? So one way is so that you know populations. It's really important to know, how many Indigenous folks you have living in your community. It's really important to know, community numbers so you can understand how to resource and allocate properly. Age would obviously be very important. Gender is very important for all these things. So, but you also need to have data to understand disparity. And that's where it gets tricky because the way I self-identify as a white woman is very consistent with the way that other people see me, right? If I walk down the street, 100% of the people that see me are going to say, oh, that's a white woman. But a very good friend of mine, her identity does not match the way that people may view her, right? She is Latina. People consistently do not think, she thinks of herself as Latina. People do not experience her that way quite often, right? So there is this challenge of phenotype, right? Like the way in which we walk in the world the way people see us may not match the way in which we self-identify. But for public health reasons, we need both, right? Racism is a public health issue. We can't capture the impact of racism if we don't understand race and how that shows up. So it creates a challenge. And like I said, there's no good solution for it. And it's really different based on communities. So where I live, we are a Latino hypergrowth area. We have been for years. In our community, it's really important to capture subcategories within the broader group of Latino, right? Like it does matter in my community if you were from Central America versus South America versus, North America, if you're Mexican. It does matter where I live. So that probably needs to be parsed out. And so the best way to think about this carefully is to get really, smart people who think deeply about these issues come together and make decisions collectively. Because I do know one thing. I do know that if one person makes this decision, it's going to be a bad one. All right. Does that get at that question? Hopefully. All right. We are going to now go into actual discussion around these things. Are you all ready? We're going to do this a new way without a chat. It's going to be exciting. I'm going to throw in 4 examples into the chat that you do have access to. We are going to look at 4 examples of open data. So these are completely open data, sharing of compensation by name and salary. All of us, well, I'm no longer a public employee, government employee, but I was my entire career until I came to Penn. And so my salary has always been public until very recently. So sharing of compensation by name and salary. I'm sure a lot of people have this. The next one is traffic stop outcomes by race. So this is not by person. This is by like a subgroup. The next example is a name. So it's arrest records by name. And I would like to point out, this is arrest records, not charge record, or like they have not been convicted of anything. These are just people who have been picked up for, you know, suspicion of something a lot of times. And then the next one is aggregate information on daily inmates in custody. So in your own mind and thinking, go ahead and categorize these. And we're going to ask people to just unmute and talk through it, because that is the only path with no chat. So we're going to do it.
So when y'all are ready to speak, if you could raise your hand and I will give you permission to speak. So that way we could have this discussion. That would be awesome. Thank you.
Great. And if you do have a specific question, you can also throw it in the Q&A. I can see all of those. Yeah, Leslie, jump in.
Yeah, actually, is there a way to make those links for the chat copyable? You have
They're hyperlinks on my side.
Yeah, so you have to click on them to get there. Okay.
Yeah, they're live. They're live links.
Yeah. Okay, thank you.
And if you want to see the visual of what this looks like, if that's easier for you, because all of y'all probably stare at data all day long, this is what they look like. These are just screenshots. That helps. All right. Anyone have thoughts? Clear ideas of placement? So I guess we'll just go down the line if no one wants to jump in. Sharing of compensation by name and salary. Would you put that green, red, or yellow? And feel free to, like I said, drop these in the Q&A and I can read them aloud too if you don't want to unmute, or if you're in a loud place, or I have small kids, so when I don't unmute, that's usually why.
We have a red, definitely sharing of compensation by name and salary comment.
Okay, so that high risk, low benefit. So a lot of advocates around kind of the sunshine laws, the open data movement around all this is they're pushing for transparency of government employees. In my world, I've always found it really helpful to have these not by name, but by categories, because it's really helpful for advocacy. Because, for example, like where I live in North Carolina, it's very easy to look at the open data and show that our teachers are paid, you know, some of the lowest in the nation, which is helpful for advocacy efforts. But yeah, as someone whose salary was in our Charlotte Observer a couple of years ago, it's a little awkward. All right, what about traffic stop outcomes by race? Any thoughts there? Is green, yellow, or red?
Seeing a lot of ones.
Okay, so
in the Q&A.
High benefit, low risk. Great. And just a reminder, I can't see any of that. Oh yeah, I can see it. I'm sorry, I wasn't scrolling. Okay. Lots of green. Excellent. Okay, it looks like we have a couple yellows. Great. All right, arrest records by name. So again, these are not aggregate. These are not, you know, these are by name, and these people have been charged with nothing. Yeah, pretty solid red. It's not hard to see where I fall on this based on what I say about it. I think that this is completely unethical use of data and get very irritated by it. I will say I did use this data quite often when I was a principal, which feels like a very long time ago, but the kid didn't show up to school. There was one place to check, but in my opinion, this data should not be publicly available. Oh, sorry, wrong button. All right, next one, daily inmates in custody. Again, this is aggregated data. These are counts, and think of like how this data could be used. So what would you see this as?
We have a comment if we could refer to the boxes by numbers, not color, because we have some individuals who may not be able to see the difference in colors.
Okay. Great point. All right, so there we have one, a lot of ones, so high benefit, low risk. We have one that is number 3, so low benefit, low risk, but no one sees this as high risk data use, which I would agree. Oh, I stand corrected. We do have someone who sees this as high risk, low benefit. So Mike, you want to talk about that? Interested or add a comment to it? I always learn a lot when people just like come at this a different vantage point. Usually means they know something I don't know. Anyone jump in? Daily inmates in custody.
Yeah, so it's just that if the names of the inmates are linked to that data versus just an overall aggregate number or anonymous data.
Yeah, this particular example, it's just aggregate numbers.
Okay.
Yeah, there's no name.
Then low
Yeah.
risk.
Yeah. So there's no name in B and there's no name in D. So there's no PII, PHI in B or D, but there is an A and C, if that helps.
Yeah, thanks.
Cool. All right, so it seems like for most of us, a bright line here is identifiers, and I would agree. Like, and also privacy law tells us that we have a lot of federal protections around data, and these federal protections largely fall on whether the data is identifiable or not. But we also know that with data science techniques, just because something doesn't have a name on it does not mean it's de-identified, right? Having anonymized data is almost impossible to do now, especially if you have multiple sources. So something else to keep in mind, just because it doesn't have an identifier doesn't mean that it is low risk. All right, we good with this? We got the idea. I'm going to keep on rolling. Okay, so now I want you to think about your own data in Colorado. So tell me about your open data. These were just some examples. Apologies if I picked really poor links. I don't live in your state. I have visited it quite a bunch and enjoyed myself, but I don't live, so I don't know your data as well or at all. So if you don't like these examples, pick another one. But think through your data source and then just like give us some thoughts around it. Feel free to unmute and discuss. We have some time intentionally to think through this together. So what do you notice? Oh, sorry, it looks like I didn't delete 2 words. What seems like a good idea? What seems like too little data? Like what is just completely not helpful? Sometimes health statistics, aggregated at the state level is kind of worthless. Although sometimes it's very helpful if it's a very rare occurrence. What seems like a good idea for racial equity? I would put, for example, like the traffic stop outcomes by race in that category. And then what are unintended consequences? So I would think a good example of that one would be the arrest records by name. Folks haven't been charged with anything, yet that could affect all kinds of things, employment, family situations, there's the unintended consequences there are just vast. And then, who has been asked these questions, like who is in the data and who's missing, who is hidden or who is over surveilled.
I can start out. We need someone to talk through an example. My office at the Colorado Department of Public Safety, we have a variety of public dashboards, and one of them is a dashboard about disproportionate minority contact in the criminal justice system at like different points of the justice or different points of the like court system. And I think this data is really important to examine because it has so many implications for our criminal justice system. But one of the downsides is that we don't have great ways of identifying like race and ethnicity in our like court data because our judicial system doesn't track Hispanic or Latinx identity. And so we developed an algorithm to try and estimate the number of people who identify as Latinx or Hispanic. And this is just a very imprecise way of measuring it. And then we also just have this category of other, which is not specific and not helpful. And I think this doesn't allow us to really get at a lot of the unique disparities that we're seeing in the justice system, just with our data visualization and categorization techniques that we've adopted just because of the overall data limitations.
A great example, right? That unavailable data piece, like if you don't collect it, it is unavailable. And so then you either have to impute it, which has huge equity issues, or you have to guess at it, which also has huge equity issues, right? So yeah, I mean, you just summarize like a lot of challenge in this work. And so one other approach would be just not to report race and ethnicity at all, yet we know that there are dramatic disparities in involvement, system involvement, and court involvement in particular across gender and race and ethnicity. So yeah, it's a conundrum for sure. And so the question becomes like, do you caveat it? I mean, do you just put caveat boxes and disclaimers all over your dashboards? And then even that, they like, you read them and then, you know, a lot of times I look at like the margin of error on the ACS and I'm like, why are we even publishing this? Like this margin of error is garbage. Like just delete it, right? This isn't helpful for people. It's misleading to even publish it as accurate, valid data. So then you get at that place of like, should we even be publishing this data? Is this allowing people who don't have data literacy to come to a conclusion that is wrong?
Mm-hmm. Oh yes, and I see we have Dennis Wright who has raised their hand.
Hi, thanks for the moment. You can lower my hand. One of the considerations we have when looking at this data, and it's something that bothers me a lot, is from the analytical standpoint, we often will look at between group variations. So we'll look at one race versus another, or one gender versus another, et cetera. But we don't do a really good job at looking at within group variation. So that's one issue we find. The second big problem that I find is that oftentimes, especially when you have like arrest data or anything like that, what we start to do, especially those with low or middling data literacy, is that we start assigning causality to it. And that in and of itself is a big problem. So we start saying, okay, this race is overrepresented in arrest records or anything else. We start to say, well, what's wrong with those folks? And we definitely are guilty of putting data out there without context. And that happens a lot. I'm an epidemiologist by trade. So historically, we don't do great with that. It's something that I think we're starting to reconcile, but I don't think we can get away from just producing data without those stories. One of the things you mentioned, which was really cool, was the margin of error. Oftentimes we look at confidence intervals and you can drive a truck through them. I'm like, okay, so why would you even use this data? Totally. At the same time, I have to also state that these are measuring actual people. So then we have to deal with how we deal with small groups and small numbers, aside from just suppressing it. We do need to describe it some way, in a way that makes sense. But our traditional ways may not be the most beneficial, especially within the lens of health equity.
Yeah, because when we suppress, that causes erasure, right? So we are through our suppression rules, which are a protection of privacy that is widely used, right? I mean, HIPAA, like that is FERPA, our main federal laws around this, like they mandate it, but that causes complete erasure of subgroups. Yeah, it is. All of this is a conundrum, which is why you hear me keep on saying, like, there are no answers here. The only answer is you got to talk about it with people who have like very well-informed opinions from a variety of perspectives and a variety of lived experiences. Like that's, in our mind, that is the only path forward with this, if you're truly going to center racial equity. Yeah, and one other note I'll say, this also just completely depends on your context, but so where I live in Mecklenburg County, we don't have a majority population. So we don't have a demographic group that is over 50%. So we actually, as much as possible, try to eradicate the terms majority or minority, because it's not an accurate term. So that's something else for you to think about. I mean, the state level, we are in North Carolina is majority white, but like in our county, whenever we talk about our own numbers, we really have to be careful around that language, because to assume that majority means white is centering whiteness, right? So that's another just caveat around open data and like thinking about the way in which we talk about these numbers is really important. The language we put around it. We want to make sure we're not prioritizing certain groups, centering certain groups over others. And it's, it's a million things to think about. And so the more minds around it, the better. All right, we're going to keep on going. We've got one more activity and then we'll wrap up. Sound good? Okay. We're going to do it again, y'all. You ready? Okay. This example is going to be focused on restricted data. So these are examples of data use that involve identifiers. They involve legal agreements, and all of these had data well, not all of them. Several of them have data governance around them. Not all of them. Okay, this is what they look like if you click on their site. So this is pandemic EBT. This is a Florida statute. I'm not sure where they are on like the technical process of this, but by law, they're allowed to do this. This is a look at family and children homelessness. So they're using education and housing records. So homeless management information service, and then McKinney-Vento if people are familiar with those data sources. And then this is data that was linked across a wide variety of sources at the family household level, and then aggregated to neighborhoods. That helps. All right, so click away. Those are all live hyperlinks. Please let me know if they don't work. One of them was dead when I checked it a couple days ago. I think it's fixed now. And feel free to just unmute or drop in the chat. I will read anything that anyone writes, and also happy to have folks talk. The session is for y'all. Please jump in.
I see that some of these data sources aren't just like dashboards that we all can view, because it seems like they're a little restricted. I guess I'm just wondering, Dr. Hawn Nelson, if you could discuss the use of integrated data project to inform quality pre-K expansion. If you could just give a little bit more summary about what data sources are being pulled together.
Sure, and if it'd be helpful, we have time, so I can do that for all four because they won't take long. So let's start with A, and as I talk through them, then we can kind of rank them as good idea, maybe not great. Think about it. Okay, so a pandemic electronic benefit transfer. Hopefully you all are familiar with this. This was something that went into place right when the pandemic occurred. We know that a lot of children across the United States really rely upon food nutrition services at school, right? So free reduced lunch. And so what they did was and in case you don't know this, there's something called community eligibility provision that went into place in like 2015, 2016. And that pretty much just said like the paperwork burden of this is so that instead of requiring an individual paper for free reduced lunch, if schools meet a certain threshold based on a couple of different sources, we're just going to give the whole school free reduced lunch, right? So there are a lot of schools that get that. So for example, my children's school is a high poverty school and we all get free reduced lunch. We call it my kindergartner, we call it her breakfast buffet because she eats breakfast at home and then eats it at school. She loves it. So when the pandemic struck, one of the ways North Carolina approached this was they gave pandemic EBT cards. We actually got them in the mail for any family who had a public school student in a school that was part of the community eligibility provision. We literally got like an EBT card in the mail. It was magical and it was quick. So this was a data sharing agreement that took place between our DPI, Department of Public Instruction, our Department of Health and Human Services. They matched the data at the person level, matched addresses, and sent out the direct benefit, right? Lots of legal agreements involved and decades of cooperation between those two state agencies. So the question was, this is very restricted data. We're talking about like education records, like records of folks living in poverty, like incredibly sensitive, restricted data. Children, right? So where would you put this? Would you put this as 1, 2, 3, or 4? I will say as a parent who got money in the mail, it was a 1.
Yeah, I can definitely see a lot of the risks too, just with some of this information just being really sensitive.
Yep. And a lot of states didn't figure it out. I will also say that. So
Yeah.
North Carolina was one of the quickest. When you look nationally, a lot of states, it took them months to figure out this economic support. But a lot of that is because North Carolina has really rigorous data integration infrastructure already in place. So, all right. Whoop, sorry. The next one is this example here on the bottom left, how many housing vulnerable children and youth were also connected to food nutrition, child protection, and foster care services. This is an example of a use of an integrated data system. So as was the pandemic EBT, there's like a routine data integration process within North Carolina Health and Human Services that was used for that. So both of these were established data infrastructures used. So this example is out of Charlotte-Mecklenburg. This is my community. The integrated data system is called the Charlotte Regional Data Trust. These are standard reports that they produce annually. And they frequently look at the number of children in the school system that are also experiencing the HUD definition of homelessness, as well as the Department of Education definition of homelessness. Lots of legal agreements. Everything is an aggregate. No names are reported in any format, if that helps. All right, so would you put this example at high benefit, low risk? So 1, 2, 3, or 4. So this comprehensive look at youth homelessness in a large county, which is my county, which is about 1.3 million people.
We have a 1, and then we have Samantha Smith said, interesting how the overall culture of data at the state level has those disparate effects.
Yeah, Samantha, I would love to hear more about that. I'm not quite sure I get the disparity there. If you want to add more. All right, so I think we all agree the second one, it's completely aggregate data. It gives a good snapshot. These data have been used for many years for allocation of resources and for like targeting schools with additional supports. The other way, it's been a really good way to get resources from the federal government, because federal money pays for individuals who are identified, children who are identified as McKinney-Vento, and that money then flows to the schools and to the families. So that's how it's used. That's the whole like action. All right.
Samantha, would you like to elaborate?
Yeah.
Sure. Yeah. So that comment was just in relation to the example that you shared about the rollout of the pandemic EBT benefit in North Carolina, which has a very robust data integration system versus other states. I was just interested to see how that has that sort of specific effect in this one emergency related instance.
Totally. And that's exactly, like, you just nailed it on what we saw nationally. Like states that already had infrastructure like Indiana, Ohio, South Carolina, Washington, California, these pandemic EBT responses were really quick. Yeah. And the states that didn't have that. All right. We're going to keep on rolling. So monitoring social media of students by school district. So what do you think? 1, 2, 3, or 4? Yeah, I think we can all summarily agree that this is not a great idea. Lots of risk, not ability to make a lot of action. All right, and then the last one here is risk factors of individual children to childcare supply and planning. Just a quick summary of how this happened. Some colleagues of mine at Penn were approached because Philadelphia instituted a soda tax, and as public health folks, I'm sure you know what that is. And then they said, okay, what are we gonna do with the money? The money was allocated for early childhood, and people came forward and said, like, well, early childhood is not equal. So how do you figure out quality, but also the kind of geospatial mismatch of, like, a lot of the issues of childcare isn't supply or demand, it's like supply and demand relative to where people live, right? And so they used individual level data through the integrated data system in Philadelphia to connect that. And then they gave suggested areas of where to focus the money from the soda tax. So that is the summary of that research, which is continued to be used by Philadelphia. So 1, 2, 3, or 4, like most sensitive data you could imagine of families across Philly. But they have provided access to childcare in new ways. So, and this is what it looks like here, the maps that they did. That helps. All right. Okay. So it looks like folks, so the connecting risk factors to planning, supply planning. We thinking 1, 2, 3, or 4 for that. 2. Yep. I would agree. I think this is one that is careful. Like there is risk, but there's tremendous benefit. So yeah. All right, y'all, we are almost at time. And I just want to wrap us up quickly to say that, this is, I hope, your biggest takeaway of this work is, like, there is something for all of us to do no matter where we are. For those of you who are EPIs versus those of you who are executive leadership and everything in between, there's something that all of us can do to think about this work in a more nuanced, careful way and make shifts to practice, right? So if you could think like one word or phrase that you'll take away from this, and if you drop them in the Q&A, we can drop them in the chat, or I can read them aloud. So one word or phrase that is like a sticky idea or question or thing that you think you'll be thinking about as you fold laundry later. Maybe that's just me. I fold a lot of laundry. All right, any sticky thoughts?
Yeah,
Great.
getting mindfulness, enlightening, diligence is important. Risk versus benefit framework, data governance. Yeah, I like no easy answers, but asking tough questions is a good place to start.
Great. All right, y'all, thank you. appreciate it. This is my email address in our newsletter. If you're interested in more content, we try to write a lot of things that we learn from sites. So would love to learn alongside all of you. And thank you for all the work that you do for your state and then nationally, as we all learn from y'all, because Colorado does some very cool stuff.
Thank you, Dr. Hawn Nelson, for your presentation, and to all of you for attending this session and for engaging in the Q&A. A few short announcements before we send you on your way. As we mentioned, slides and any additional handouts are going to be available on Sched for all of the presentations. You will receive a conference evaluation form via email after the conference is over. Please fill that out, even if you only attend a portion of the conference. It's very helpful for our planning committee. And there will be a raffle for people who participate. You can win one of 2 gift cards for $50. And then up next on the conference, we have 4 breakout sessions, and they will start at 1 p.m. You can go to Sched for the full schedule for the conference. And thank you again. It was really happy that you all are here for the 2023 Culture Data Conference. Thank you so much. Really appreciated your being here today. And thanks for also bearing through all of the technical difficulties.
It was fine. It worked out.
Yeah.
It was a talkative group, which is great. Health people are talkative, is my some other group, maybe not so much. So,
oh, that's good to hear.
Really great questions. Like, learned a lot, and was grateful that people felt comfortable unmuting and jumping in. So,
Dr. Hawn
nice.
Nelson, I know Wavine is raising her hand, so I was gonna
jump in.
Speak.
Sure.
Oh yeah, thank you. No, I just raised my hand because I was jumbled and all over the place, but I wanted to say thank you for, that was a great presentation, and just thank you for your time and sharing your experiences and expertise with on behalf of CPHA. Thank you.
Thanks for the invitation, y'all. All right. Well, enjoy the rest of the conference. I hope it goes well.
Thank you.
Thank you so much.
Hey, Allison.
Yeah.
I cannot open the Zoom for the next, I'm tech moderate or tech person for this next 1 o'clock. And for it just won't launch. I have no idea why.
And did you log into Zoom with the the email address?
Mm-hmm.
Oh no.
Yeah. So I'm
and
in
what
a pickle.
session are you in?
So this is the one where Kim Boyd is moderating.
Okay.
I don't remember. I can pull. I have all these tabs for this conference up, so I'm trying to go back and forth. But yes, I did log in. Let me go back, and I do see it in. It's the 1 to 215 new partnerships and centering community.
Okay.
And it looks like it's in progress. So do I just join at this point?
Oh yeah, maybe Rachel opened it up.
Okay.
I'm sorry, Wavine, when did you try to get in there? Also, I just removed everybody because we still had a couple, we're still recording. I'm gonna stop the recording.
Okay.
Oh,
that.
okay.